Hey guys, it's Dr. Kamel. We're going to continue on in our ultrasound series. Now previously I've talked about identifying the ligamental structures that support the ankle both laterally, medially, and a part of the syndesmosis. And I've also talked about the medial compartment of the ankle, and we talked about the tarsal tunnel as well as the posterior tibial tendon. Today I'm going to help to identify the anterior compartment of the ankle, being able to visualize structures such as the tibialis anterior, the EHL, as well as the EDL. And we're going to take the tibialis anterior and trace it from the anterior compartment down into its insertion. Alright, now I'm going to show you guys how you can use an ultrasound to identify the structures of the anterior ankle compartment, as well as trace the anterior tibial tendon down to its insertion. Now, I like to have the patient seated with the foot planted on the table. That way I have good exposure and I'm still able to manipulate the foot. Now, we'll start first by identifying which side of the probe we're using. So here the notch, I know which side, it's right there on the left side of the screen. I like to place that on the medial side. So right away, alright, so what we're looking for, what I like to look for first is the tibialis anterior. So a trick that I like to use is I will ask the patient to dorsiflex the foot and keep the heel planted. What that will do is, What that will do is it will fire the tibialis anterior, and when I place my probe, I can see exactly where the tibialis anterior is. And I can see the probe is only identifying where the tibialis anterior is. And then now when I have the patient plantar flex the foot again, I get everything into full view and I know exactly where my tibialis anterior tendon was. And from there, you can see the two other round structures. So tibialis anterior medially, and then the EHL in the middle. And then laterally you have the extensor digitorum longus tendon. Alright, so now that we know where we're at, I'm going to take the probe and go down into the longitudinal axis, and right away I can see that beautiful echogenic fibular structure, the anterior tibial tendon, right, running across the top. And then I can see the ankle joint just underneath it. You can see the tibia going down in, and then you can see the talus. Alright, and we're going to trace this tendon all the way down into its insertion. So right there, I can see it inserting into the cuneiform. Okay, and then you can trace it back just to make sure you didn't miss anything, and even go in through the axial and trace your tendon all the way to the insertion. Alright, now I'm going to show you guys some images to show you some pathology and kind of highlight again some of the things that we reviewed today. Here you can see an anterior axial sonographic image showing the three tendons of the anterior compartment. I'm going to go from medial to lateral. So the tibialis anterior, indicated by the arrowhead, you can see, and then the extensor hallucis longus, indicated by the thick arrow, and then the extensor digitorum longus, which is indicated with the thin arrow. There you can see that there is a curved hyperechoic line deep to these structures, which represents the cortical bone of the anterior aspect of the distal tibial epiphysis. Here you can see the anterior tibial tendon in the axial view at the level of the ankle joint. It is normal, echogenic, and fibular in nature without any signs of effusion around the tendon. Now, if you take your probe and switch it from axial to now longitudinal, you can see that this view shows the anterior tibial tendon running over the tibial-talar joint. Now, the curved arrow indicates the distal tibial epiphysis, and the arrowhead indicates the talar dome. And you'll be able to see the anterior recess of the tibial-talar joint but that's usually only visualized when there's distension secondary to effusion fluid. The tendon itself, which is on the top indicated with the arrow, has a typical fibrillar appearance and is running superficial to the anterior recess of the tibial talar joint. Now you can see we've traced the anterior tibial tendon from the ankle joint now down distally into the insertion into the cuneiform. Now this is just one of the two slips. There is one slip that inserts at the base of the first metatarsal, and here you can see in the distal aspect of the first cuneiform its insertion. The tendon itself is normal. It is echogenic and fibrillar, just like we would see with any other tendon that we have reviewed already thus far. Thank you guys so much for watching. I'm excited for the next video in this ultrasound series, so stay tuned, you guys. Thanks.